The U.S. is in a constitutional crisis. The president remains in critical condition, and while the vice president is out of intensive care, he remains unable to assume his constitutional duties. Therefore, the Speaker of the House is the acting president. Continuity of government is a major concern. 1/3 of the U.S. Congress is dead or incapacitated, as are 2 members of the Supreme Court and senior members of the administration. Government functioning at the federal, state, and local levels has been brought to a near halt. After the failure of the first vaccine that seemed so promising 15 months ago, along with several other candidates, we now see fresh optimism. The Omega vaccine, which has finally been shown to be safe and effective, is just starting to be deployed as fast as it can be manufactured and distributed. 1/3 of Americans are expected to have access to the vaccine in the next 6 to 8 months. Global vaccine distribution and dispensing, which is an enormous undertaking in the best of circumstances, has been slowed in many locations by riots and looting at vaccination sites. Infectious disease specialists seem to agree that once 80% of the people have been vaccinated, the epidemic should be brought under control, with an ultimate 20 million deaths in the U.S. These same infectious disease specialists say we're lucky because the virus is similar in some ways to common para-influenza viruses, and only 1 dose of vaccine is needed. The situation in most of the rest of the world is much worse. Massive loss of life, economic collapse, famine, and civil unrest. There's been a mass exodus from cities, adding to the spread of the disease and making vaccination programs even more difficult. The nagging question: what would have happened if we had a vaccine many months earlier? If the first vaccine had worked and started to be deployed at 6 months into the pandemic, the U.S. death toll could have been reduced from an anticipated 20 million to 6 million, with similar reductions in economic and societal consequences. On the other hand, what if years go by without a vaccine? Then, experts tell us that we could eventually see 30 to 40 million deaths in the U.S., and more than 900 million around the world, 12% of the global population. Eventually, once almost everyone's been exposed, the disease will either burn itself out or become endemic, like the dreaded childhood diseases of prior centuries. What the world will look like when it's done is still very uncertain.
We are continuing our coverage of a new and deadly infectious disease.
The virus has some genetic elements of the Nipah virus.
The care of these patients requires extraordinary effort.
We cannot and will not voluntarily take patients from other hospitals.
The creation and intentional release of the Clade X virus.
The impact of not doing something has lots of consequences.
We can't retreat from the rest of the world.
Continuity of government here cannot be overestimated.
Federal quarantine of this scale is unprecedented.
The question everywhere: when will there be a vaccine?
We have got to engage the private sector.
They know that we don't have a vaccine yet. They want vaccines to be prioritized.
I would not want to pull those people back.
And we need on the ground to be able to assure protection of our first responders.
This is a non-starter. I'm going to need these people. I got this feeling in a whole lot of other places.
More than 40 countries are reporting outbreaks, and many more are suspected of having cases.
Leadership requires doing things that are oftentimes unpopular.
This issue has the amazing capacity to be number 11 on anybody's list of 10 most important items.
We have been unbelievably weakened by this crisis.
What the world will look like when it's done is still very uncertain.